Let's get started. It is 10:02, so welcome everyone and good morning and actually good afternoon to our presenter who's on the East Coast. We have a great webinar, I think, today for you all on fatherhood engagement. We'll be talking about engaging fathers, why it's important, and strategies for doing that. Our presenter today, I should mention first of all the housekeeping stuff. If everyone could just put your name and site in the chat for attendance purposes, that would be great. And we're recording this, so we'll post this and you can refer to it afterwards and share with colleagues, other staff. Of course, this is applicable to folks in all roles, I think. So yeah, get the word out and let them see the recording as well. We have today with us Amina Alio, a professor from the University of Rochester, and she's done quite a bit of work on engaging fathers and quite a bit of work just generally in the field of maternal and infant health. But yeah, we're lucky that she has that focus on fatherhood engagement. And I'll just read her bio here so you can know a little bit more about her. Dr. Amina Alio, she's an associate professor at the University of Rochester Medical Center, Department of Public Health Sciences, and the Division of Social and Behavioral Sciences. That's a lot to fit on a business card. She's an applied anthropologist with extensive experience in community-based participatory research, evaluation, and qualitative and mixed methods research methodologies. She's a Fulbright scholar with international experience in reproductive and sexual health outcomes. Dr. Alio's research focuses primarily on health disparities in maternal and child health, examining socio-behavioral factors affecting maternal and infant outcomes. And for the past 15 years, Dr. Alio has been working with the National Healthy Start Association on the issue of involving fathers in perinatal programs. And she's been an advocate for involving fathers in the pregnancy process in order to improve birth outcomes. So I will turn it over to Dr. Alio, and thank you so much for joining us today, all the way from the East Coast to talk about fatherhood engagement.
Thank you so much, Steve. Good morning, everyone. Good to see your faces. And thank you for having me. I'm always excited to know that there are people who really care about engaging fathers and are doing it. And it makes me happy that it's happening. So thank you all for your work as well. I wanted to know a little bit more about you. So I'm wondering if you have where you are at as far as your program is the fatherhood component. So you, for example, do you have a male coordinator in your programs? No male coordinators? Okay. Do you have a specific curriculum that you use with the fathers? No? Okay.
I don't know if anyone else wants to chime in. There are others who were involved in some of this work. We do have some training now, just recently introduced on fatherhood engagement for our staff and our network. So there is that. And then we have sort of what we call the consortium in LA County. That's a group of over 60 organizations, mostly home visiting related, that now does have a work group on engaging fathers. So that's a fairly new work group, but that's something. And actually, one of our own outreach specialists here is a co-lead of that group. So
awesome.
I don't know if that helps. Anyone else can chime in as well.
Yes. Anyone else? What have been some of your challenges, you think, as far as engaging fathers? Some of the main challenges?
Well, I think our roles here are a little different because we do enrollment for the program. So we're not working a direct service practice with the families. although some of us carry dual roles and do direct service. So when we're presenting to enroll families, we do let a lot of the times the primary case person know that if their partner wishes to participate, that's always an option, and it's open as long as it feels safe and comfortable for them. So that's kind of like where we kind of plant that seed a little bit for the direct service work that comes after us.
Awesome. Okay.
For us at Northridge Hospital, again, the part that we're involved in is enrolling families. But when enrolling families, I do tend to mention, hey, the family, not just mom. So yes, I'm going to schedule your first welcome baby appointment with your parent coach. We'd love to have dad involved as well. Or a family will say, can my husband also join in on the call or join in on the visit? Absolutely. This is a joint effort. This is a family effort. So yes, we do try and include fathers. It's a little easier for us. And I don't know if other people experience this due to demographics. So we're located on the west side of the San Fernando Valley. Incomes tend to be a little higher on that side. So we do notice there's more flexibility with both parents in terms of their job. So we'll have more fathers involved because they can take the time off.
Okay.
Join in on a Zoom meeting or a meeting in their home, and they're more, they just have more of the time. Where if you go into more of the areas that maybe both parents don't have a 9-to-5 job, they're working very long hours, different times of the day, that might be a little more difficult. It's been our experience. I don't know if anybody else has experienced that as well. But on the outreach portion, yes, we do try to involve dads as much as possible.
Okay. Okay, thank you. Just trying to get an idea of where you are in your program and what you're doing. So thank you. And we can certainly talk more about your roles throughout the session. So normally I would have a very interactive session, but I have to say that I haven't figured out how to do this very well on Zoom yet. So I'm very much a face-to-face, in-person type of, so I'm sure some of you might understand what I'm talking about, I'm sure. So, but we'll do our best, and feel free to interrupt me if you have or we'll definitely have questions and more of a discussion at the end. So I can tailor things a little bit more to what your needs are. Okay. So if you're at this point, then you're already understanding and are aware of the importance of fathers in maternal child health, maternal infant programs, for the family in general. But I do want to go over a little bit what it means to be, to engage fathers, why it's important, some of the challenges, and look at some strategies of what has worked for some programs out there, as far as strategies for engaging fathers. Okay, so again, feel free, if Steve, if you or someone would mind looking at the chat, if someone puts in something that I need to address, feel free to interrupt, not a problem.
Thank you.
Yeah, so so what do we mean by father engagement? You see the word father involvement, father support, and so on. So I usually use engagement because it's not just about including fathers or recruiting them, but it's really about engaging them in the process, not just in your program activities, but also in the life of their child, of their pregnant partner, and so on. So it's both program as well as personal involvement with the family. So, and also I want to specify that in this presentation, I'm referring to biological fathers, to male partners of a woman who may not be the biological father, or any father figure that may have been designated by the mother, or a natural father figure in the family. So just to clarify, so why engage fathers in maternal and infant health? Studies have shown that fathers are important not just for child development. There are a lot of studies looking at child development, school achievement, the importance of fathers, and how it impacts school achievement, and development with children, but really not much on pregnancy and the early infancy. So, and the idea is that we don't wait. Fathers are important across the life course. It's not just for after the baby has been delivered, but it's throughout the life course. So if we talk about before and in between pregnancy, again, these are all studies that have been done. Some of them were mine, some of them are other researcher studies. And I'll be happy to give you all my references. But studies, I'm summarizing the findings. Family planning, reproductive life planning, and contraception use has been shown to really reduce unintended pregnancy. It has also shown to increase the use of birth control and help reduce the risk of sexually transmitted diseases for mothers. As far as in between pregnancies, the father's physical health and preconception risk behaviors, so such as smoking, and there are studies actually that have looked at marijuana as well, the use of marijuana by fathers before conception, and different environmental exposures that directly affect the genes through the sperm. So it affects the quality of the sperm, it affects the genes, and those are the ones that are passed on to the infant. So the whole idea of we tend to put all the onus on the mom's health preconception, but it's also important to educate fathers and for us to also be aware that the conception for fathers begins, before conception, not just it's not just the act itself. So there are also studies that have shown that during pregnancy, the father's engagement can really affect maternal stress positively. It can really reduce the stress for the mother, whether it's through physical support, encouragement, financial support, and so on. But there are also studies, of course, and this is common sense, obviously, that they can also be the cause of stress if there's domestic violence, intimate partner violence in the home, or if they're not providing financial support or not recognizing the pregnancy, for example. So they've been shown to both reduce the stress, but they can also be the cause of some of the stress. And they also can affect maternal behavior. There's studies that show that the fathers were really good at encouraging positive behaviors among mothers. So eating right, not smoking, making sure they go to prenatal care appointments and so on. So these have been shown to be associated with the fetal growth, preterm birth, and infant birth weight. So these are the three sort of health outcomes directly associated with those stressors and behaviors. As far as before and in between pregnancy, so we talked about, am I going backwards? Family planning, reproductive life planning, contraception use, All of these can help unintended pregnancy and so on. Yeah, now I'm going forward. Okay. Some of the work that I'm doing now is really looking at maternal mortality and maternal morbidity. The past few years, we've been talking a lot about maternal mortality in the US, how it's on the rise. Actually, California, I read a lot about what's been happening in your state to try to address maternal mortality. And I think it's one of the example states that we use to really look at what can be done to try to address it. But despite that, there's still quite a bit of a disparity between certain groups, primarily Black mothers, First Nation mothers, Native American mothers, compared to the other women. So we still have those disparities. So it's still an issue for your state as well. But in the work that I'm doing now is really looking at the experiences of fathers during the delivery process and right post-delivery, soon after delivery. What I've noticed so far is that fathers really can be an advocate for mothers, and they can really also help reduce maternal stress during the process. Looking at Black mothers especially, we know that hemorrhage, for example, is a big cause. There's a lot of physician, clinician issues also tied to the risk of Black mothers dying while delivering. So again, it's we're working on it now. One of our papers just got accepted, so it should be coming out soon from the journal Maternal and Child Health. But we are continuing the work in this area, and what we're seeing is that it has a potential to reduce maternal mortality and some of the maternal issues that result from difficult deliveries. So beyond pregnancy, father's role has been shown to influence breastfeeding, both initiation and duration. They've been helpful with dealing with the postpartum depression among the mothers. They're usually, if they're around the mom, they're usually the first to notice signs and be able to really help, and also provide physical assistance with the care of the infant. And this can obviously really impact not just the maternal health, but some of the social development and the health outcomes of the baby. So on the other hand, when fathers are not engaged, the literature shows that when they're not engaged during pregnancy, there's a greater risk of infant mortality, and this is across all races and all ethnicities. So all fathers are really key to get involved in all these programs. As the infant grows, obviously, when the father's not involved, it's been shown to be associated with the social cognitive issues or slowing down the development for the infant. So again, these are studies that look at the other side of when they're not involved. And it really just confirms that it's important to engage fathers. So any questions about some of these studies? No? Good. Okay. So involving fathers in maternal infant programs, there are many challenges to that because there are a lot of socioeconomic issues that fathers face that may affect the way or how much they're engaged, right? So it could be lack of employment, that limits their engagement financially, perhaps. It could be incarceration, and having multiple infants or multiple children that they have to support. That is a financial burden as well as a time burden for some fathers. But also our society really sees the woman as the primary nurturer, the primary caretaker, and the primary person responsible for reproductive health and for caring for infants. So I think there's a shift in our own thinking as a society that needs to happen. And you can see it in even the way we name maternal and child health programs. It's not family programs, it's mom and child. And then we want to add the father. So even in our own policies, we see that the focus is really on the mother. And the responsibility is also placed on the mother. So there are some funding issues and policy issues that arise because of that. Geographic location can be an issue for certain fathers. And in my work, I've seen that there are many fathers who have this sense of inadequacy. Not, I want to be a father, I want to be engaged, but I don't know that I know how, or I don't know that I'm going to do it well. And it's something that they may not talk about, but in our focus groups and interviews, a lot of fathers talked about this sense of inadequacy as a father. And many of them mentioned not having a father role model themselves, or having one that they don't want to emulate. So there's that need to encourage father to have peer support, and to provide some training and so on, education. So these are some of the barriers, additional barriers. The relationship with the mother is an important facilitator or a barrier to father's involvement. Relationships are complex, as we all know. And the mother is really the gatekeeper to the father being engaged or not engaged. At least she can be the gatekeeper. So finding a way to go around that and to really inform both of them of the importance of the dad being involved can be a challenge sometimes. But it's also important to note, to again bring up the issue of domestic violence, intimate partner violence, and to be aware of that reticence of the mom to engage the father, making sure that there's not some issue that needs to be addressed, a deeper issue, as far as safety for herself and the baby, for example. Okay, but again, sharing information about the importance of dad's involvement in the baby's life and even during pregnancy, that can become an incentive for moms to focus their attention on the well-being of the child rather than being upset about the relationship between the couple. So it's bringing the attention to the child rather than the relationship, which again can be challenging. Other challenge, the focus on women, as I mentioned, and fathers are not really expected to be involved in preconception, prenatal care, interconception care, and so on. I think there's a movement to try to do that, but I think the funding and the policies have not really, we're not there yet in those areas. So hopefully, slowly that will change, so that we look at this as a family as a whole, and provide support for mothers and infants. Okay, so issues like paternity leave, and assistance to families that sometimes penalize the presence of a dad, All of these need to be looked at and thought about better, how to better get around those or change them completely. Okay, and then there are other barriers. There you know, issues with their own perceptions of fatherhood as a culture, as communities, different groups. So there are many cultural variations about the perceptions of fatherhood. There are many myths that exist about dads, and I'm sure you've heard some of these. You've heard about people calling dads deadbeat dads, terms like that, or talking about fathers don't care about their children, or they're just interested in making them but not taking care of them. And we need to get away from those myths, because in much of my research, one that I'm doing currently now with the National Healthy Start Association, we're finding that these myths are actually exactly that. They're myths, and that fathers really do care, and they do want to be involved. So again, the culture issues we have to sometimes deal with that as well. And our staff as well, right? And ourselves as we work with them. So again, as you think about approaching father engagement, it's important to look at your own stereotypes and myths, and maybe in your community or in yourself, and really change the narrative to a positive one, that fathers really care about their children, they want to be involved, and there might be issues that are preventing them that we can help them address. So there are not really, in academia, we talk about evidence-based. So there aren't many really strong evidence-based strategies out there, but there are many promising strategies that are informed by the literature, by the evidence, even if they haven't been formally evaluated. So the most important, of course, is to really understand, define the group you're engaging, prepare the environment, think about your outreach strategies, tailor your message, develop or think of activities or programs that you want to do for fathers, and so on. And I want to go through each of these quickly. So if you're thinking about who you're engaging, because obviously you need to understand if how you're going to tailor your messages and how you're going to target your recruitment. So it sounds like in your case, you're really, your opportunity is to engage the fathers of the mothers and infants that you serve. So it could be that, or some groups actually invite other fathers in the community in general. I know that there are some of the Healthy Start programs I work with. They target their own families, the fathers that are enrolled, but they also open up some of their activities to fathers in the community in general. And others are focused on adolescents and so on. So the key is really to kind of name who your target population is as far as fathers are concerned. And then, of course, preparing the environment, and you've already done that. It sounds like you're doing that. So the physical environment obviously is making sure that whatever space you're inviting fathers is actually inviting to them. Is it only pictures of mom around the wall? Are the pamphlets and magazines concerned, targeted towards women, or are there things for fathers as well? And of course, is the staff trained or experienced? And it's that training is important because, again, we all have these conceptions of fathers from our own experience, from our own observations, perhaps, and that could influence the way we act when fathers come. And I'm basing this on what men have told me in my studies when they go places, what's missing, how they're treated, and the assumptions that people make as soon as they see them, both clinicians and program staff as well. So just something to think about. Again, this is something that some of your programs, perhaps with others in your program, you could sort of go through and think about your staff, your understanding of the role of men, the idea that of can we get a male staff person, or do we have one already? If we don't, is there somebody in the community that could at least be involved in some of these activities and so on? So it's really looking at kind of a self-assessment of your program. And I think that's helpful in trying to plan and plan some strategies for improving your own program. So obviously recruiting men is great, but if you can't, women are great too. Again, the key is to be trained and to really appreciate the value of fathers. So yeah, so men of course would be great, but there's also the issue of matching populations as much as you can. Again, it's not always possible, but it's usually what we try to do for women as well as men, right? For home visitors, community health workers, again, it's important to understand, and sounds like you're doing that already, trying to engage fathers, invite fathers to be part of the program or the activities, and trying to encourage them to participate as well as you enroll them. But the inclusion of fathers, so if they're there and you're able to talk with them, that's wonderful. If they're not there when you're speaking to the woman, it could be telling her about how important it is for the father to be involved or to enroll, giving maybe pamphlets about activities you have for fathers or that might be around the community for fathers and so on. So little things like that can at least start the process of connecting with dads, even if you don't see them physically. You can also, some just examples, again, you're probably quite expert in this area. You have the experience, but these are just some examples that of some positive conversations with fathers. So again, it's the whole attitude of being positive rather than accusatory, and seeking to understand what they're going through and what they need as far as assistance with the understanding or knowing what they need as far as training and so on. Education or information about child development and so on. So outreach strategies, again, like I was saying, it's important to be specific about who you're trying to engage. If you're targeting teen parents, use the term, just say young fathers, because we know that teen parents has a connotation of teen pregnancy, which is associated with being bad. So we try to use words like young fathers rather than teen parents, for example, or adolescent parents. And one thing that we've done when I was living in Florida, we use a lot of sports themes with all the activities, pamphlets, and things like that. So just trying to think of what the interests of your dads are and try to work around that. The invite dad strategy is really to aim for direct communication about the program and involve the mother as well to encourage fathers to participate. So, and it sounds like you're doing that already, so that's great. Tailoring the message is important. I have to say that for most men, their children are really the strongest motivator. So it's not about, oh, I'm going to give you money if you come, or, you know, of course, incentives are great, but it's also really what it is that, you know, you're important for your child is going to benefit from your engagement, from your support emotionally, and so on. And we want you involved, and you invited, and we want you included. From the pregnancy, again, I'm really focusing on pregnancy and early infancy, although these strategies would work for any level as well. So incentives are always important, especially depending on your population. There might be transportation issues. There might be loss of wages because they come to an activity and lose an hour or so of work. So it's programs that have involved fathers have definitely reported that incentives are helpful. The issue is we don't always have the funding to do that. So each program will have to figure out what they can do. Food is always a good replacement if you don't have cash, but it could be linkage to employment, for example. It could be we've had lawyers come and just offer free advice to dads about whatever, everything from visitation to any issue really that they have. So that was an incentive for fathers to come, and at the same time we offer them something. There's skills building opportunities and so on. So all of these can be incentives for fathers, engaging fathers. So as far as the activities that you're going to do, again, it's thinking about what types of activities you want to engage fathers and when you want to do them. So your colleagues who are working with you, your partners could probably would be somebody, you know, you could get together and really think about what can you do with the funding that you have, with the time, with the staff that you have, in order to kind of develop your own program. So these, of course, have to be tailored to their needs, and focus on the relationship and co-parenting, and really helping them navigate through the stresses of not just a relationship, but parenting, problem solving, goal setting, conflict resolution, and so on. So, and I think as if you're enrolling, I don't know if you're enrolling fathers as well, like a formal enrollment. And if you do you have an intake form, or do you have a sort of a screening tool or needs assessment? It's something to think about as well. There are quite a few curricula out there. Again, you don't have to do the whole thing. You can take pieces. But again, it's knowing who your dads are and what their needs are. Right. So these are just a few of them, but I'm sure you know of others as well. As far as delivery, thinking about the types of activities, what's appropriate, what is preferred by the fathers that you serve. Whatever it is, once you've selected the activity or the curriculum that you want, it's important to recognize that fathers have different needs, different interests than women. And they also need to be educated on reproductive health and infant-child care, infant-child health, and their role in the process, the importance of their engagement in the process. And also it's important to cater to men's learning style. It's interesting, I don't know if you've seen many of the articles the past couple of weeks about college enrollment going down for men. And it's actually becoming a concern that, you know, we're getting 60-40, where a lot more women enrolling, and it's actually a decline of the men enrolling in school. So, and, you know, is it the way we teach? Is it the way we're we're learning that's not hands-on? Who knows? There's a lot of debate about that. But we all know that the learning style is different, and active participation, hands-on learning is much more beneficial to them than just discussion. So changing a little bit the way we do the activities with them, becoming more interactive, and so on. As far as their needs, again, many of the programs, like I said, we don't have the resources or the ability to meet the needs of all our clients. So not just fathers, but mothers as well. So for mothers, we do a lot of referrals. We have partnerships, and the same thing would apply for men, especially for men, because it's usually an add-on to our programs, and the funding often comes with requirement. I know Healthy Start has begun to do that, to require the engagement of fathers, the inclusion of fathers, and they have to report on that. So it's important to find agencies in the community that serve men, the types of service that men need, the resources that they might need, so that when you do enroll fathers, when you do engage fathers, even if you can't meet their needs, you can at least refer them. Same thing, the same way we do with women's needs. So creating partnership is important. Identifying the resources where you can refer fathers is definitely extremely important, because most programs don't have the resources to do that. So again, provide information on resources for men, referrals, and so on. And again, it could just be having flyers, brochures, to give to fathers when you do home visits or when you do enrollment. The mother can give it to the father, or you can give it to the father directly. But it's things like that that show that there's that you are thinking about fathers, and that they are important, and you've already prepared a list of potential resources for them. So that's something we could do. So whatever your program does, it's really important to keep track of what you're doing, how it's working, and continuously, look at what you're doing and evaluate. Especially because we don't have an ideal program for fathers out there. We don't have one that fits all communities. So there's a lot of taking pieces from different programs, adapting it to your community. So it's important to keep track of what's working and what's not working for you. And another issue is really to obtain baseline information. So again, the intake form, needs assessment, screening tools. There are some tools out there that you can use similar to women's that you can use to sort of get a baseline and understand their needs. We're doing a big project right now with Healthy Start on this National Healthy Start Association, creating sort of a universal package of tool. So we're piloting it. We're done piloting. So hopefully it'll be available, sometime soon. So our objective is really to have a sort of a packet in order to give programs something ready for them to use and adapt as they need to. So hopefully that will come very soon and be available. So getting feedback from dads also, you can have formal assessments if you have an evaluator, perhaps, or you can just create your own. But really, even just having informal conversations about what their suggestions are regarding whatever activity you had. Suggestions are for outreach for other men. There are suggestions for future topics or activities, all of that. It can be informal conversations or formal focus groups and so on. But the key is to really obtain feedback. And that's really important for continuous program improvement, obviously. So here's a sample checklist. And I think this is online too. I don't remember if this was part of what we posted online. But the next few slides are just sections of a checklist that can help guide your program, the work towards reaching fathers. So it's really strategies you're using, the methods that you're using to do that, the training of your staff, the resources, and so on. And also, again, the environment, the welcoming environment for fathers. So anyway, you'll have the slides, so you can definitely have these questions if you're interested in really solidifying your program or expanding it for fathers. Okay, so basically, father figures, they can really impact maternal infant well-being. But even though we know that, they're still left out of preconception, interconception care, prenatal care. But then, of course, as soon as a baby's born, we expect them to support their children after birth. So the key is really to start early as possible, to engage them in the process. And the first step is to get everybody on the same page, recognizing that it's important to engage them, and really, if we do that, we're doing families a big favor by trying to address the needs of fathers, even if it's through referrals. So the other thing is to really understand that fathers themselves have needs. Just as if the mother had a problem with abusing alcohol or with other behaviors that would be detrimental to her health or to the child's health, we have programs to help address these. Same thing with fathers. They do have needs, whether it's issues with alcoholism or domestic violence and so on. There are things that we can do. So rather than just not enrolling them or, not wanting them involved, it's engaging them, but meeting their needs or trying to help them address their issues. So So if there's a domestic violence issue or alcoholism, do we just not enroll the father? Do we just not engage them because, he's going to be stressful to the mom? Or do we help them address those issues by referring them or starting a program that will help address it if it's something that's very prevalent in your community? So that's better than not engaging them, because by helping them, obviously, we're helping the family as a whole. So I really was trying to finish up quickly so we can talk a little bit. So we have a few minutes, so I'm happy to answer questions, or I also want to hear from you if you have comments or suggestions or experiences that you want to share. So I'll stop sharing so we can see each other.
An experience to share. I had my last child. I was 38 years old, so I was an older mother, and we are seeing more older mothers conceiving. And my second husband, he was great. I mean, I could not have done it without him. Having a child at 38, my last child, I experienced a lot of a postpartum depression afterwards. I did not experience that with my first two children because I was very young when I had them. So this last pregnancy was just so different for me and my body. And so after I delivered, I had 3 days where my postpartum was just crazy through the roof. And I didn't even want to look at my child. And my husband, that's where he was able to really come in and really help me out during that period. Did I expect to have postpartum depression at the degree I had it? No, absolutely not. So when it did happen, and my husband, who was involved from the very beginning, read the books with me, watched the videos with me, educated himself on the whole process from prenatal to postnatal, he was able to just step in. He just stepped in and took over for those 3 days. I don't think I would have been able to do it without him had he not educated himself and was a part of the process. So I do share with a lot of my older moms, have that involved. You don't know how the pregnancy is going to end up. You don't know how you're going to feel afterwards. And every pregnancy is different. So it's really vital to have dad involved, because in my instance, he had to actually jump in and take over until I felt better. And it took about 3 days, and then I was back to normal. But those 3 days were very crucial to have him involved. And later on, my daughter's 13 now, but she has autism. So again, having him involved, I mean, I don't think I would be able to even raise my autistic daughter without him. We tag team. We're supportive of each other. So I do fully believe that dads do need to be a part of the process, and they are very instrumental.
Absolutely. And having that personal experience is a great way to really engage others, because you can share your own story. Yeah, absolutely. Well, I'm glad he was around to help, because that certainly would be difficult. Yeah. Anything else? Are you all out?
I have a question. How can we, let's say, introduce or talk about the father involvement during pregnancy? I noticed lately, because we've been doing all this virtually, I do a lot of phone calls, and I do enroll mommies into our Welcome Baby program, and it's all virtually, and the majority are young moms. And one of the questions for the intake is like, is father of the baby, do you have the support father of the baby? And a good number of them said, no, I'm on my own. No, I prefer not to put him as part of it. So any ideas how, I mean, it's obviously that I cannot say, oh, it's important for the father of the baby to be involved and for pregnancy. If that our first hand said, no, it's just me. No, I'm a single mom. No, just put me. Oh no, it's okay. Oh no, we just live together, but I'm not married. So again, I don't want to get into the we live together, we're not married. To let my opinion go in there, because for me, living together is like being married because the commitment is there. But that's just for me. So that's my own thinking. So I cannot put that in there, right? So, but I have a good number of prenatal mommies that says, no, we're not married. No, I'm single. No, he's not. He's not involved. So, any ideas on how we can do with this?
That's very common. That's very common, and that's what we were talking about. The mother is the gatekeeper. So, if so the key is really to try to understand why that is, but that happens maybe not the first time you speak with her, but the first time you speak with her and she says that, I mean, one thing you can say is, oh, okay, well, even if he's not involved or if he's not around, it's not a problem, but we do have programs for him, or we have this activity for him, or if we have information for him, can I leave information for him, or can I mail information? Or, you think he would be interested in learning about fatherhood or prenatal care or whatever it is. So it's really, not even touching the relationship, but saying that you have resources or information or something that to help him as he transitions to be a father, or as he is a father for this child. So it's kind of going that route. That's why it's nice to have pamphlets, or at least have information about what's around that you can engage fathers in, like the activities. So
That's
just
good.
on him and the fatherhood, not on their relationship.
Yeah. Thank you. Yes,
A whole other issue.
Yeah, I can go on that side. It's just because the
Yes.
question, the way the question is.
Yeah.
But
Mhm.
also, I encourage a lot with the mommy said like, oh well, if it's virtual, can my husband or father of the baby, so, oh, absolutely, yes, this is especially for you guys, and I kind of stand and go extra and giving all the good reasons for the father of the baby to be involved. But my thing is with the ones that are not involved, and like, what can I say to encourage that? Okay.
Yeah, and it's also emphasizing that it's good for the child, and it's also good for the mom. It's going to help her. But I think the way we ask questions on these intake forms,
yes,
needs to be changed as well, which is something that we're doing. Oh, the sun is shining in Rochester. Wow. That's new. Sorry, the sun just came out. I'm excited. You're lucky in California. But the question about, does the father support you? I mean, I would automatically think finances. And that's not the only way fathers can support, even if you don't give anything, if you spend time with the child, or give me a break for 2 hours, or play with the child. Financial support is not the only thing that they can give.
Yeah, you're right.
The way we ask the question is not quite, we're not asking the right questions on our form sometimes.
That's a good thinking, because I can tell when I said support, they're automatically thinking about, is he giving me money?
Right.
I got you. I noticed that before, but that's one of the questions in the intake. I mean, I'm not here to change it, but it's a good
maybe we can.
observation.
I mean, maybe we can change it.
Yeah, I mean, yes, but it's a good observation, because like I said, I observed that before, but then with some mommies, they do like, oh, well, no, he's not working. I'm the only one who's working. When they go that route, then it gives me the opportunity to explain and say what I mean with support. But then if they don't ask, we usually don't go that route, but that's a very good observation. That's a very good thing. Very, very good. Thank you.
Yeah.
It was very helpful.
No problem. Yeah, and sometimes it just shuts them down, because, in Florida, we had a lot of undocumented fathers. So they don't want, the mother is protecting the father by not telling us that he's around.
Yes, we do have same
Yes,
kind
that's
of population in
right.
here in
So
California.
we wanna be careful how we ask, because we don't care. We just want the father to support the mom, to be there for the mom, not support, to be engaged in the child's life. So,
Yeah,
so
yeah,
it gets complicated, but
yeah. We definitely need to change the wording. I like
yes.
that.
Yeah.
And I was just gonna add, like for Tina, what I do with the prenatal mommy, the intake, if they don't want to add the father, the baby, or the partner at that time, I always tell them, oh yeah, I totally respect that. If you want to add them later, you can always do that. Like we don't have to just like stop right here. So I told him, because it'll be good information, and even if it's like if he wants to join on his 10-minute break at work, or you want to share the Zoom link, you could talk about it further with your coach, things like that. So like I don't want them to feel like, oh, that was it. Like just because they said no, I do let them know you can always add them later if you wish to. We don't have to do it right now.
Thank you for the input. Yeah, I usually go different route when they said, oh, no, I don't have the support. And I said, oh, okay. Do you have any family member that will be able to be there for you to support if you need any help? And then they go different and then kind of react different. But yes, a lot of our mommies do protect their partners. Oh, no, he's not here, or he's not around, or, I mean, they do, even though they live in the same household, or they're together, they still say no, because in a way, like I said, they're always protecting, and they prefer to just say it's just me. But yeah, I understand, Ellen. Yes, I got you.
And I know, I'll just add too, I know we're a no pressure, no judgment kind of operation, and I think that's a good thing. But just as Dr. Alio mentioned, just to indicate and remind moms that those resources are available for dads. Maybe, we don't have to get them involved, and if there's a situation that she doesn't want dad involved, again, no pressure on that, but maybe just letting her know that there is an opportunity through this program to help him become a better dad and to provide those resources. I'll remind everybody that in the new edition of the Welcome Baby book, and Dr. Leo, this is a book that all families who enroll in our program get. We made the point of really trying to make it more inclusive for partners, fathers, to provide helpful information for dads in there. So that's one thing. And then, of course, there are all the other activities that we share that the parent coaches and others can relay on to families that are geared to helping dads too. And whenever we find something like that, we'll try to share it. But anyway, yeah, great points about just making moms know that there are resources through this program available for dads to help them. But they don't have to be directly involved, obviously, if they don't want that.
I think one of the problems too is that a lot of moms, especially moms who get aid, they have this fear of sharing information regarding dad because that affects their income. It affects their aid. They have this idea, oh my God, they're gonna let this department know and that department know that I receive aid from, and then it's gonna cause a huge problem. So I think also kind of making them feel like, well, we have nothing to do with those agencies. We don't report anything to those agencies. This is just more of support for you while you're pregnant, support for dad, but we don't report anything to those other agencies. I think letting them know that relieves some of the fears.
Absolutely. Yeah.
I'd like to say that as a 60-year-old woman, my father is now, he will be 89 this year. He's still healthy, strong, well, but I tell you, his involvement in my life was invaluable. I mean, I can think of when I was a fat, chubby teenager and feeling ugly and unlikable by guys. My dad took me to the prom. And that was just the best thing that ever happened to me because he gave me value. He made me see that it wasn't about me being fat or awkward. but that I could be beautiful and loved just the way I am. And so you just never know how precious a father's involvement is. I remember as a little 5-year-old, me and my sister, my dad worked 2 jobs at first. He would come home exhausted, but when he didn't have time to play, he would lay on the porch in the backyard and let us play tea party on his back, and he'd be sound asleep, but we'd be playing away, and I think that if fathers saw themselves and how potentially valuable and life-changing they are, they wouldn't want to miss it. You know what I'm saying? So I think that our literature needs to have the science of how life-changing and affecting they can be, and the potential that they have to be great and life-changing, plus mixed with testimonials. I think that would be excellent part of the literature. I'd be glad to tell my story. And I'm sure that others of you would too.
Yeah, there's actually a lot of science on development, on the impact on girls and boys. I do a whole presentation on how it impacts girls' relationships and boys differently. There's science out there, but it's just not, I feel like it's hidden in academia.
Right.
I feel like it's out there that people don't know that there's actually proven science that this is important. So I think that your job is kind of to be the liaison between the science out there and the reality on the ground, So yeah, it's out there, but unfortunately, that's not what CNN puts on the news or Fox
No.
or whoever you listen to. And
I mean, the thing
it's
about
not
it,
promoted. Yeah, it's not promoted. Yeah.
my parents were divorced when I was 13. And yet, because my dad and mom, when we were looking, they were smiling at each other, but when we looked away, they were growling at each other. But they worked as a team to get us to where we are today. Statistically, a Black family from the hood, we should have had all kind of stuff going on. You know what I'm saying to you? But we didn't. None of my brothers were ever incarcerated. There were no teenage pregnancies. We weren't the stats because God is good, first of all. And then secondly, my dad was always there, even in the tough times. So, I would like for fathers to know, hey, you guys are important. You're very important. And whatever time you spend with your child is important time. It's a passion of mine. So if there's anything I can do to help, you let me know.
Okay. All right. Miss Sylvia, I got you. Yeah, absolutely. Yeah.
Dr. Alio, I really want to just thank you for your time today. In the last hour and some change, I've really enjoyed learning from you. You've mentioned some resources like the checklist, for example, that was included in your slides, but I'm wondering if there are any other places or any other resources that you know of that you could recommend to this group so that we could lean on that and borrow and adapt as needed to help with our outreach efforts and really helping engage fathers in this program and in this process.
Yeah, I wish there was just one place. I think National Healthy Start is trying to be that place, but we're not there yet. I mean, there's several. There's Steve, you probably know them, the National Fatherhood. I'm blanking out. I can send you the National Fatherhood.
I don't know, is it National Fatherhood Resource Center or
Yes.
actually federal, right? I mean, it's like
Yeah.
.gov.
Right.
Yeah, we can round up resources like that too. And if Dr. Leo, if you have others, maybe you can share. We'll send that around in a follow-up email after this.
Okay.
Along with your
Yeah, I can
slides.
send you.
Slides are just great resources too. I think all the like the talking points and tips and specific activity ideas. I think that's super helpful as well. But yeah, we're always on the lookout for anything that really speaks directly to families. It's not academic, but really simple, plain, and communicates well with fathers. If there are like guides or tip sheets or anything like that, I think that would be great. We can share that throughout our network.
Absolutely.
And just about the Healthy Start packet, could you? Maybe I kind of missed exactly what that was, but you were talking about the packet of resources through Healthy Start coming out, and could you just describe that again?
So one thing that we're doing, I mean, I've been on the Hill trying to negotiate and advocate for dads, and it's just complicated, and but one thing we want is, in order to prove that your programs are working, is we really need to have sort of a universal way of collecting data. The intake forms should look the same, right? At least similar, so we can compare, we can kind of have an idea of the fathers we're serving. So we're trying to develop some tools for programs that will be similar across the board. So we've been testing it, a couple of tools in multiple, like I think we had 19 sites where we tested them. So both border sites, rural, urban, trying to see what's working, what's not working. But we want to have that available for organizations such as yours, programs such as yours, so you can use it. Just have something more universal, because there's just piecemeal out there, right? So it's, but we're doing it without funding, and it's just, so it's taking us a little bit of time, but we're getting there. So this year, I know that there are a couple of tools will be out and available. So yeah, so work in progress. And our intake form does not have that question of, do you have a support from your dad? You don't have that. From the father, sorry.
Yeah, maybe we'll have to look at our intake form again. I don't recall exactly what it says there, but if it does ask about support from dad, I guess, as you mentioned, Dr.
It's just changing the language. It's just changing. Yeah.
We can look at that for sure.
Yeah.
In the meantime, of course, you could just remind everyone that support isn't just financial, right?
Right.
Anyone else have other comments or other questions for Professor Alio? Anything else you want to share about engaging fathers, or an experience you've had? What seemed to work well, didn't work well?
I can share this story with you. When I used to do outreach at the OB clinic, I ran into a couple in there, right? And so anyway, the mom was telling me about her little problems, and she wanted to sign up for the program. So when I got her basic information, the dad's like, "I'm so glad that you're helping her, because she's really mean. She's just so mean." I'm like, "Oh, poor boo-boo." And then I've had other dads, just giving them something as simple as an ink pen. They were like, "That's for me?" I'm like, "Yeah, that's for you. You're important." I mean, you'd be surprised how little things, just that support, and just that sincere, "you're important," goes a long way with them. But boy, he was glad, because he said, "She is mean."
Yeah, sometimes we need to help the dads.
Yeah.
Yeah.
I would like to thank you, Dr. Alio, for this presentation. And I learned a few things, especially when you in the presentation talk about, we need to know the culture, we need to know how to really approach these families, because we don't know. I mean, only they said on the experience that we have about father's involvement, but it's very important for us to know a little bit of how fathers seem or face or go through when the partner is pregnant, because we only know the woman's side of it. Well, I don't know the father side, especially when we do outreach. And an example of that is that before outreach, I used to do home visitation. And there was a father that, because of lack of my knowledge as well, and the culture, I took wanted to be involved as a being intrusive, as a being possessive with the mother, right? Because I remember going into the home and have the visitation, and she was sharing with me intimate personal information about her relationship with him. And I don't know if he hears or what, but all of a sudden he comes and sit in the middle of the client and myself. And I was not easy. I was like, what is this? What am I supposed to do? How do I going to address this? Because I didn't took it as like, oh, he wants to know about the pregnancy and about what can he do. No, I didn't took it that way. But and my intuition, it was like he was into something else. He wanted to find out what the client was sharing. But at the same time, it was a very tough situation because I didn't know how to respond. And I mean, of course, you know, I tried to play it along, and I said, oh, no, you want to be involved. You wanted to hear what we're planning about this, and we're working in this goal. What do you think? You know, I played off right away, but my first reaction and my first intuition, it was like, what he's doing, this is not right. And then I saw her being uneasy about it. She was not like, oh my God, he's involved. No, she was more like, oh my God, he found out. Right? So it was a tough situation. And that has a lot to do with culture. It has a lot to do with the education or that I had about father involvement. Mm-hmm. And definitely we need to learn about the culture and how men see themselves during pregnancy.
Yes. And it really varies by culture too. So yeah, but you handled it well though, at least. So.
Well, I think we've got 10 minutes left, at least as far as what we booked, the 90-minute webinar here. I just a quick question kind of on the issue of how to get dads involved. This is not maybe so much about outreach, but more just in terms of service delivery and the services we provide. I thought that was really interesting when you talked about offering like a legal aid session for dads. And I was wondering how that kind of thing is pitched. Like if we were to have some sort of activity, or even the activities that are outside our network, we refer often a lot. That's sort of how home visiting goes, just about connecting families with resources. But how is that pitched? I mean, is it really just for dads, or was it something that was for?
It was just for dads.
Okay.
Yeah, it was a way to show them, you know, that we know that you also need help. We know that not all of you can afford a lawyer, and we want you involved, and the child support or whatever is an issue. It was really just to an incentive for them to come to our program, honestly. So, and they really came because that's something that fathers usually have questions and they don't get to have that free available. Yeah, so when you say pitch, do you mean you advertised it, or?
I guess just sort of how that was framed. I was just kind of thinking too about what you said in terms of how trying to get dads involved in, say, just a discussion group, you know, like a support group to just discuss parenthood or something is probably not that appealing. I mean, I can't speak for all dads, but that's something that probably wouldn't appeal to me either, really, just to get together with dads to talk. Like,
Yeah,
but something to have like a more specific focus, like something more practical, like that legal advice, or even just kind of tools you can use to be a better dad, to help your kids. That I just thought that made a lot of sense.
yeah, and yeah, if you invite them to come share their feelings, they're not going to come. So, but there's also the peer mentoring. So even if you have a sports event, that's when men get to talk during those events, or there could be something before or after an educational session. And a lot of educational sessions that we do too, they're very practical, like they're actually learning how to change a diaper with the dolls. Sometimes some of the men, they actually bring their baby. So we try to make it as practical as possible instead of just sitting there and doing what we're doing right now, which is right. So yeah, sports, any kind of activity, I guess, that would, and services as well. Services like the legal aid was definitely very popular. Job, the other one is like a employment, job fair, things like that you can host. Yeah, so yeah.
Yeah, that's really helpful.
Issues. There are also re-entry programs that you can do if there's somebody that offers them around you. Re-entry for formerly incarcerated men. Because they really, if they've been in prison for a long time, they really don't know how to get involved with their babies. But they want to mostly. So how do we do that? What kind of services would they want to figure out how to get a job after you've been incarcerated, or, yeah, so.
Yeah, those are great ideas. Yeah. Thank you.
And find out who's doing those things around you, because we don't want to reinvent the wheel. We don't have the money to be doing all this.
Right.
So find out who's doing it, and can they come to a session, or can you invite the dads over there? So whatever it is, find out what's happening, and because I think we don't want too many silos of everybody trying to do, but we can combine efforts. Yeah. Get that village together, all the different components.
Exactly. Great point. Any other questions for the professor? Anybody? Well, I think this has been a really, really enlightening, really useful, talk about practical too. I really appreciate the practical strategies and activity ideas, and everything you discussed in this presentation, I think was really helpful. And yeah, I encourage you all to share with your coworkers too. We'll, as I said, make this recording available so they can benefit from these helpful tips as well. Just want to thank you again, Professor Alio, for taking the
my
time
pleasure,
and the work that you do as well. And hope we can stay in touch and get the resources you continue to work on, and the information, and more helpful information and tips and ideas that come out.
Absolutely. Absolutely. Contact me anytime, not a problem.
Thanks so much.
All right. I wish you all the best with your work. You're doing great work, so good to be on the ground.